So Sharon, tell us about the improvement journey Beds has gone through in the past year.
I think the teams have really embraced improvement. I think it's given BCHS a real drive coming out of COVID to actually be able to demonstrate the improvements. And I think some of the projects have certainly been informed by COVID and actually different ways of working within that. So we've got two main differences. One is maybe an issue that was caused by COVID, things like increased waiting lists within some of our services, and projects that we've then had to implement to try and reduce that. We've got a project within podiatry where rather than just leave people on a waiting list, there's a big move to actually phone them, engage with those service users, and try and inform them as to what's going on with the service to help sort of get them engaged. And then on the flip side of that, we've got things around video consultations and actually how we can properly utilise that going forward and coming out of COVID, and supporting our service users who are vulnerable still to remain at home and still get a high quality service from our staff.
Wow, all in a year. And Alison, can you share the challenges the Directorate faced and how you've overcome them?
Yeah, so I think the obvious challenges of COVID over the last year. I think the way we manage that is the engagement we've had with each other. So there's been plenty of team meetings, plenty of opportunities for staff to speak to each other. I also think some of the QI projects was something that staff could do which wasn't COVID related, because COVID was very overwhelming. So that was a challenge. Obviously, we had to have little breaks when it was overwhelming, but what we did do when we saw a bit of light at the end of the tunnel, we picked back up and started again.
And Sarah, can you add anything to how staff have managed to focus improvement efforts on QI during the pandemic?
I think actually, Nicola, it's almost like the other way around. How did QI help us focus on what we were doing well? So in the pandemic, the QI Forum helped us to gather those good news stories and just to focus. As Alison has said, we were absolutely overwhelmed at times, but recognising the bits that were good, that the teams were coming together, that we were working in an integrated way, that we were supporting each other through the difficult patches, and pulling together that the QI helped us to stop and pause and recognise that there was good in what we were doing, and to spread that across other teams. So to recognise, you know, some of the small changes that we were making, as others have already talked about, the way we pulled teams together collaboratively, the way we supported people who were having to self-isolate, just to then to be able to share those through the QI around and spread that across other teams was really beneficial, and helped us to inform, but also helped to spread across the teams an awareness of QI and the benefits that has had. And I think that has informed our engagement in Pocket QI and people looking at then going on the Improvement Leaders Forum. So that's been really beneficial.
And Carole, what other impacts have you seen from QI on staff and service users?
I think the main one, impact of quality improvement for staff, is really that it gives you a framework to empower staff at all levels to kind of drive change and bring forth quality issues. I know I was given the opportunity to do that myself just as a Band 6. I think the way it's run in BCHS, the support from senior management and the IAs, I know for me it's made it very easy to sort of get a project going and leading a project. I think staff are encouraged to think about QI project ideas all the time. We've got a healthy forum where they can bring their ideas to for consideration. I think it's a great position when, you know, we've got too many project ideas on the table, which is kind of where we are at the moment. And I think it just shows that we've got a workforce in BCHS that is wanting to use QI to really improve. So I think that's a great place to be in. In terms of service users, again, just the way the framework itself and the way it's run across the trust, but also in BCHS, in that we encourage projects to have big I involvement, and actually we're going to halt projects if they don't have involvement or a plan for involvement. And we know that when we've got more service users on board engaged in our improvement work, we're more likely to have better health outcomes, better experience of care and better value. So it's been a fantastic journey, and I think the impact is huge.
And finally, Alison, what's your ambition for QI in Bedfordshire Community Health?
Gosh, so my ambition, and I think we're achieving quite a lot of it already. So we've got 12 people on the leadership course, which is phenomenal, starting at the end of this year. We've also got, I think, is it 5, 6 people on the coaching course. And my ambition is that QI is our platform for any change. It's an opportunity for any member of staff, regardless of what grade you are, where you work. If you have an idea, you can put it on the table and you'll be supported with that idea. And I think it's given people, as Carole said, the authority to be able to do that. And I think it's a great way of doing it. And also we can celebrate it together as well. That's it.
Thanks so much for sharing how you've managed it. I'm really looking forward to seeing what improvements that could bring.
Thank you.